administered in Ohio, 361,603 shots that have been given. That's where we are as of today. Again, maybe to kind of to recap a little bit about vaccines. The big picture on vaccine always comes back to this: we don't have enough. We hope that this is going to increase as we move forward. We hope that will be additional streams flowing in. We have 2 streams now, Pfizer and Moderna. We hope the production there goes up. We also hope there are more streams that are coming in the near future. But as of today, we have to deal, like all states, we have to deal with this scarcity. Our goals. I know we get a lot of questions. I get questions all the time, and I know people wonder, when am I going to be in line? And when does my group come in? And isn't my group, can't we make a good case for my group? And I haven't seen one group yet that didn't have a good case. But we have a very limited supply at this point. Our goal eventually is to vaccinate anybody in Ohio who wants the vaccination. But we're not there yet. We don't have the supplies yet. And we have to take this literally 1 week at a time. But what are our goals? Our goals are, number 1, to save lives. Number 2, to get our kids back in school. And number 3, to help our first-line medical personnel who are working every day with COVID patients, who are working there to protect us. And we got to keep them working. We got to protect them. So those are the 3 goals. And those goals drive absolutely everything that we do every single day and every decision we make in regard to vaccines. Let's talk about the saving lives. And there's a figure that I've cited before, but I want to cite again because I think it's so crucial to understanding what we're trying to do in Ohio. 87% of all deaths in the state of Ohio have occurred with people 65 years of age or older. 87%. So we have gone at this, and we have gone at this, very, very hard. Let me talk a moment before I get to that, let me talk about protecting our health workers. That's going well. We're moving forward. We don't have them all protected yet. We know that there's some dentists out there and there's some other primary care physicians who have not been covered yet. Our local health departments are working very hard to make sure that they get that vaccine. So we're making good progress there with our health workers, getting kids back in school. We are today, just to give everyone an update, literally about almost exactly 1/3 of the kids in the state of Ohio are in class every day, 5 days a week. About 1/3 are there in a hybrid model a couple days a week, and 1/3 are totally remote. So it just breaks out. That's where we are. So we're seeing more coming back in person or in hybrid, but we still obviously have a lot of kids who are fully remote, about 1/3. So let's go back, though, to revisit the saving lives, how we're doing. We have some really, really good news. Bad news, of course, is 54% of all the people who've died in Ohio have come out of nursing homes. 54%. So obviously, that was one of the first places we wanted to be able to protect people. And we have very, very good news. We have 930 nursing homes in the state of Ohio. We are a state that has a lot of nursing homes, not just because of our population, but we have a lot of nursing homes, frankly, because if you base it on population, we still have a lot. So 930 nursing homes. We have partnered with 4 different pharmacy companies, and we checked back with them within the last few hours. Here's where we are. And we work with them every day, and we're very happy with where they are. CVS reports that they have gone now to 97% of the nursing homes that they were assigned to give that first shot out. 478 facilities they were assigned to, they only have 10 to go as of the beginning this morning. FarmScript, they have done 61 of 63 nursing homes. They have 2 to go, and they're doing them today. Walgreens, They've done 95% of their 398 facilities that they have been assigned. So we're very happy about that. They put more shots in more people's arms in nursing homes in Ohio than in any other state in the union, and they're working many, many other places. Finally, absolute pharmacy, they're done with the first phase, 100% of the nursing homes. So that is the good news. They're going to go back now with the second shot. Some of them have started back, and additional good news, anecdotally at least, what we're seeing is when they go back into those nursing homes the second time, we're seeing more staff take it, and we're seeing more residents take it as well. We don't have the exact numbers, but we're seeing an uptick in those numbers, which is very good, and we're very pleased with that. We have, according to the federal government's figures, we have administered in Ohio better than 8% of all vaccinations that have been done in nursing homes across the country. So we're 3-point-something% of the population. We're over 8% of that number of vaccinations in nursing homes. So done very well here. Let me go continuing on the theme of saving lives. Again, a statistic that I cited a moment ago, 87% of all deaths come from those 65 years of age and older. So we have people in nursing homes, and we just told you about that. But we also, of course, have people who are not in nursing homes, who are out in the community. So we will start this coming week with people 80 years of age or older. We hope, we'll see how this goes, every week to move down 5 years. So we start with people 80 years of age or older. And let me kind of walk everyone through that. The shipments come into Ohio beginning on Monday. They arrive on Monday, Tuesday, and Wednesday of each week, and they go out to the different locations. So we have told the federal government, we have told the pharmaceutical companies, we've given them 750 locations. So if you are 80 years of age or older, beginning Tuesday, Wednesday, and Thursday, you have those locations are available. Now, the caveat is, and we've talked about this before, but not everyone 80 years of age is going to be able to get a shot next week. The numbers just don't work. We have about 100,000 vaccines. We've spread them out across the state. It's a question of equity. We want them in every county. We want them in every part of bigger counties so that people do not have to drive very far or go very far to get a shot. But we only have 100,000 for next week, and we know there's 425,000 approximately people 80 years of age or older. So we can do the math. It's going to take a while, but we want to get started. And frankly, we wanted to give our 80-year-olds who have the most risk, at least a week, get that week head start and to start down that path. And we frankly want to see how that works the first week. This is going to continue to be a work in progress as we work our way through this and try to deal with the scarcity issue, but also try to make sure that people are fairly close to a place that actually has it. How will people find out about this? This process is started. It's not done. Local health departments, some of them announced yesterday the locations that would have the vaccine in their county. Other health departments will be announcing that today, and maybe even some tomorrow will be announcing those. So the media is being informed county by county by the local health department. So that's something you'll be able to see in your newspaper, maybe watch on TV, pull that online. Second, we've asked every health department to be up by tomorrow morning on their webpage with the locations in their particular county. Number three, tomorrow morning we will go up on coronavirus.ohio.gov, coronavirus.ohio.gov, and you will be able to pull down and look. You can search it by county, or you can search it by zip code, and it will tell you where those locations are. It will be up to those individual locations that have the vaccine, that will have the vaccine, to do their own scheduling. This is the way we're going to start this out. As I said, it is a work in progress. And we will see how that goes. Now, as I said, each provider, I want to emphasize this again, each provider will do their own scheduling. Some caveats. Not going to be enough next week for everybody, but our goal is to get as many 80-year-olds vaccinated for their first shot as we can next week. I know we're very happy to get started on this very, very vulnerable group. We prioritize those individuals who candidly are the most likely to have a bad outcome, most likely to face a high mortality rate than other people. That's based by age, so 80 and older. Next, we will continue to learn. We will continue to adjust as we go through. One of the driving forces for us to do this decentralization and do 750 sites across the state of Ohio is equity, racial equity, economic equity. And we wanted, instead of having one or two big sites, for example, in our urban areas, and we may come to that, to add those to what we already have, and we believe we will, and we're working on that now. But we felt to start with the limited amount we have now, putting it in neighborhoods, putting it in local pharmacies, putting it in local health departments, putting it in federal clinics around the community was the way to go. So we know that in rural areas, this is going to be different than it is in urban areas. In a rural area, a small county may have 3, 4 locations, and that's going to be a lot simpler. We know that in an urban area, it is not going to be that easy, and that there are going to be many, many choices, and that people will have to navigate that. And we understand that that will cause some frustration. We decided to start that way, frankly, because we did not want to see what we've seen in some other states where they have one huge center or several big centers. People show up and they wait for hours and hours and hours. So the frustration for us probably is going to be on the front end in our urban areas where they have many choices, where people try to either get online or they try to call and schedule an appointment. Once they make that connect, however, and get the appointment, it should go a lot easier than it does or would if we were just doing central sites where people can drive up to. Now, as I said, we will move to a combination hybrid system in a few weeks as we get more vaccines in. We hope we're going to move to the opportunity to have more big sites where people can go to, along with the more neighborhood or more local sites. We will learn, we will adjust as we move forward. We are in the process of trying to and working on a state central scheduling system. There were some, frankly, that we could have taken off the shelf. We have seen problems with some of those. Our advisors told us, and our best estimate was, that we need to not do that because that would cause some real problems. We want to make sure we got this right before we put this up. So that is how we're gonna start off. Eric, let's go to the data real quick. The first data you will see, of course, is our standard slide. We're fairly flat, as you can see, 7,600 new cases. Unfortunately, our deaths are up above the 21-day average. Again, our hospitalizations are up over the 21-day average, and our ICU admissions are up. So none of those are good. None of those are good figures. Let's go to the next slide, Eric. Our standard 88 counties, as you will see, all counties are blue, which simply means they're all above the national CDC's guideline for high incidence. In fact, if we go down to our lowest county, which is Holmes County, Holmes County is our lowest. They're about 3.5 times the high incident level. So everybody is very high. Eric, let's go to the next one. Okay, this is our advisory system, and you'll see one significant change. let me just go through this a minute. We're not necessarily seeing a dramatic surge after Christmas yet, but there's a bit of an upswing in our cases. Reflecting this, Hamilton County is moving to purple this week. There are also 2 counties that are moving up to the watch list because of increases in healthcare utilization. That's Lorain and Claremont. So again, all in the same, well, Claremont's in the same region. Lorain, of course, is at the other end of the state. While most of our counties are not changing color, I did want to point something out on our key measures map. And if we can go to those maps next, Eric. And again, these are the maps that we would ask you to look at more than the color map that you just saw. These key measures are 2 critical pieces of information for every Ohioan to understand about the situation in their area. The new cases during the past 2 weeks in their county and the impact of COVID on their regional ICU beds. So that's the one on the beds. As you'll see, the new cases per capita at the statewide level has increased since last week, and that is not good. And this is where you see that here. We've gone up from 656 on an average statewide to 739. So we're seeing cases up, and that is certainly not a good sign. We were already at a very elevated level of 657 cases per capita last week. Now we're close to 740. On the other hand, the portion of ICU beds with COVID has gone down slightly. ICU use is a lagging indicator, so this is still coming down from our pre-holiday peak. However, it does look as though our cases are starting to increase again. So that is where we are. Let me go to the Lieutenant Governor. Sean?
Thanks, Governor. I wanted to add a story about one of our counties that I joined this morning as they rolled out their plan for vaccinations. Miami County, I joined their public health team along with the Miami County EMA for their rollout announcement of the vaccine this morning. They had all of their partners on that call, all of the locations where the vaccinations would be occurring, and provided the local community with the information on how they would apply. Each provider in this particular community is requiring registration and the appointments to get the vaccine. There'll be no walk-ins, and registration for each provider begins at a different time, though. And I'm going to give you for example, Miami Public Health opened their appointments at 9 today. They were full by 2 p.m. Back to that point that every vaccine dose that they were expecting to receive next week already has a person assigned to receive it for Miami Public Health. But they also have other locations like a Kroger, little clinic there that doesn't accept registrations till Saturday. But the point being is that they're organized. There's a means to get registered at every location. And that those will come at different times, and that there will not be enough to serve everybody. It's just a local example of the macro message that you just relayed, Governor. And our goal is to get this out as quickly as possible. And these communities are organizing themselves, giving you a way to do that, making sure that every dose of vaccine is going to have a patient, a person affiliated with that vaccine when we start next week. And I want to thank Miami County, the public health officials, their partner entities who are going to do this, and all the counties in the state who are working to organize this on both ends, both a smooth process up front, which when we have over 750 locations, we're all learning from that and working to get it right, and then a smooth process for making sure that those vaccines are distributed next week. Additionally, on the economic front, I have an announcement that I want to make regarding General Motors and the Mahoning Valley and the agreement that we struck there last year, where after a thorough series of discussions, the Ohio Tax Credit Authority approved a recommendation from the Ohio Development Services Agency to terminate the job creation and tax credit agreements that General Motors had following the company's decision to close the Lordstown assembly plant. As part of that action, GM is required to invest $12 million in the Mahoning Valley by the end of 2022 and refund $28 million in tax credits to the state of Ohio. Today, we're announcing the details of that $12 million investment. $5 million of it will go to Youngstown State for a workforce development partnership with Eastern Gateway Community College and funding for the Youngstown State University Energy Storage Innovation and Training Center. So as we're trying to build an entire new industry in the Mahoning Valley, we're going to have a premier education and training center right there with Eastern Gateway and Youngstown State. And that's great news, really helping to prepare the workforce of the Valley to take advantage of this entire new industry that's developing there. Additionally, there will be $3 million set aside for the village of Lordstown to construct a water tower that will serve these locations that are in great need. The Eastgate Regional Council of Governments will receive another $2.5 million for local infrastructure improvements to prepare for the growth of these facilities and the new jobs that are coming. $1.5 million will also go to the Mahoning Valley Manufacturers Coalition for development of workforce skills for the people of the Valley in some of the support industries that we will see develop as a result of this growing new industry and this new investment. GM has a strong history in the Valley, and we expect that to continue. I think that this agreement solidifies that for the future, protects the taxpayer dollars, and invests in this new industry, the electric vehicle industry. I want to, just in closing, Governor, thank some of the leaders in the Mahoning Valley area. President Jim Tressel of Youngstown State, who was instrumental, Mayor Arno Hill of Lordstown, Jessica Borza of the Mahoning Valley Manufacturers Coalition, and Jim Kinnick of the Eastgate Council of Regional Governments. This was a collaborative effort. We listened, as you know, Governor, to all of the voices in the Valley to say what makes sense. Where do the investments, where do we need to make these investments so that we can jumpstart this new industry? And that collaboration results in this announcement today, and we appreciate the partnership. So, Governor, with that, I'll turn it back over to you.
Well, John, good news from the Mahoning Valley. Thank you for giving us that good news. We truly believe that 2021 is going to be our year of recovery in Ohio, and that's some very good news about that. And also, if you could stay on there for a minute, Lieutenant Governor, the Miami, it just kind of strikes me, your report about Miami County, we're going to see replicated all over the state. And I know that there's going to be frustration sometimes when you get there and it's all filled up. The only thing I can say is that is bad news, I understand, and frustrating, but it means that the vaccines are being taken and they're not sitting and they're going to go out. And for us, as we look at the whole state, we know these are life-saving vaccines. And we know that we are protecting people when they get it in their arms. And so that is, in a way, bad news if you're trying to get in, but it's good news for all of us. The more people we can get vaccinated and the quicker that we can get this done. I know, Lieutenant Governor, you were on the phone today with some of our big city mayors. And, I want to take this opportunity to thank our county commissioners, to thank our mayors, to thank our health departments, the health commissioners. They are working with us as we go through this, and there'll be changes. They will tell us, hey, this is not working or this is working. We need to make this adjustment. So this is a real partnership, and we're going to continue to listen to them and take their ideas and take their suggestions, because they're on the ground. They're seeing what's working. They're seeing what is maybe not working. So we roll this out again beginning Tuesday and Wednesday and Thursday. And I know, John, in your conversation with some of the larger city mayors, they had a little change in how they want to kind of phrase where we're going. You want to tell us about that?
You know, I thought the mayors gave us a great suggestion of transitioning our COVID defense team to a COVID offense team, where we would work with them at getting more data to them, better feedback loop going on with our local providers and our local leadership, so that we could create a process of continuous improvement. We know that as this process starts out, that all of us are going to learn. For better or worse, we have more demand than we have supply by a large proportion right now. The plan next week will, I believe, ensure that vaccines get into people's arms as fast as they can, that it's geographically distributed so that we're looking at those equity issues, and then we're going to learn from that process with our local partners on how to make it better every week. We wish this was going to be over in a week, but we know this is going to be a months-long process, which we will continue, which we have our commitment. I know, Governor, and your commitment, my commitment to everyone, that we will continue to listen and learn and refine this process so that we can improve the customer service journey for everybody as we work through the vaccination process.
Well, this vaccine does give us the ability to go on the offense, which is what we'd like to be. Quick recap, 8 o'clock tomorrow morning, coronavirus.ohio.gov, we'll launch an online tool for Ohioans to find the contact information of providers in their county or their desired zip code. They can do it by county or by zip code, where they can get vaccinations. They must contact these providers. They must then contact these providers to make those arrangements. Looking forward, our goal is on January 25th, we anticipate vaccinations will open up to those 75 years of age or older. Following week, we hope to open it up to people 70 and older. February 8th, the vaccinations will be available to those 65 and older. So we're rolling that out 1 week at a time. To state the obvious, but I want to make it very clear. When a new range opens up, that does not mean that vaccinations will be completed for the previous age group. And you will still be, if you're 80, be able at any point to try to get the vaccination and get that vaccination. It will take a number of weeks to distribute all the vaccines given the limited doses that we have. Week of January 25th, vaccinations will be available to those with severe congenital, developmental, or early onset medical disorders. And we have a comprehensive definition of that. And we will talk about that more next week, probably next Thursday, a week from today, as we get closer to that and explain to people how they qualify for that. And again, we are trying to protect the most vulnerable people with a limited number of vaccines. And we'll go to questions.
Governor, first question today belongs to Jesse Balmer from the Cincinnati Enquirer.
Hello, Governor. My
Afternoon,
question is,
Jesse.
good afternoon. This Tuesday you mentioned there would be a new vaccine coming to Ohio. Which vaccine is that and how soon can we expect it?
Yeah, I'm going to go to Bruce. Bruce is on here. I don't know whether you've got a date, Bruce. We don't have a date because it's not been approved. So, but you might give us some indication of where that might be on the pipeline.
Sure. Thank you, Governor. No one knows when that next vaccine is going to become available. And I actually participated in a phone call at a national level. So I know that the process that has been set up, it's a scientific process. It's based upon assuring vaccine safety. And that process needs to continue to work itself out. However, we have good reason to believe that that process is going to lead to the Johnson & Johnson vaccine being the next one that will come up for review and potential approval by ACIP, and hopefully in combination with that process, approval by the FDA, as we've seen with these other vaccines. But as of today, I don't believe there's anyone who could speak to a specific target date.
Bruce, is that is the one that's been approved at the UK? Is that right? Is that the Johnson & Johnson?
Yeah. So yeah, in the UK, actually, they have the AstraZeneca vaccine. So it's a different vaccine, but our processes are different.
Okay. Thank you.
Next question is from Todd Dykes at WLWT in Cincinnati. We'll skip Todd. We'll go to Jim Oddie from WHIO in Dayton.
Hey,
Governor,
Jim.
good afternoon. This question comes to us from a viewer who is very concerned about both transparency and accountability. She's wondering if the state health department, for example, will be tracking each one of these doses in a statewide manner, and when they're taken, when they're administered. In other words, when they're delivered, when they're administered, what happens next? And then is that all going to be reported publicly? And the goal here is to make sure that nothing is wasted, which I believe we did see early on in some nursing homes to some degree. Is that correct?
Yeah, we had one bad situation in a nursing home, Jim, where the nursing home had estimated a pretty high level. When the pharmacy company got there to administer it, it wasn't even close. So it was way, way off. And they scrambled. I'll say this for the pharmacy company, they did the best they could. They got shots in a lot of people's arms, but there were some wasted. And that is the one thing we do not want to see. We do not want to see any waste. And so, you know, in answer to the question, you know, we talk about this every single day. And when we talk about our providers, when we talk about the nursing homes, any place, hospitals, we do not want to see anything wasted. And we've set up a priority list. We basically said, you need to know where you're going if for some reason you have a dose, 2 doses, 5 doses, 10 doses left over, and the clock is running. You need to already, before you start that day, have planned exactly where you're going to go with them. Now, we tell them the priority should be somebody in 1A, 1B, and that's a pretty wide group because that includes people, anybody 65 years of age or older and other groups as well. So they have ample opportunity to do that, but we are on that a lot. We are also, you know, focused on the speed. I mean, we have told everyone who's getting the vaccines for people 80 years of age and older that absolutely we want to get them out as fast as they can. We understand that some will not be able to start until Thursday just because of the way it's sequenced. They may not get the vaccine until Wednesday. It's possible even some might be late a day. So we know that some of them won't be get started even until Thursday, but we've asked them at a bare minimum to complete that in 7 days. We would love for them to get it done in 1 or 2 days. None of them are going to be getting a great deal of it now because we don't have a great deal. It's going to be 100, 200, 300 or so doses. So they should be able to get this out very, very quickly.
We'll go back to Todd Dykes at WLWT in Cincinnati.
Hi, Governor. Apologize for the lack of unmuting. Quick question for you. I've been following the CDC vaccination dashboard for some time. The CDC indicates Ohio has received 960,000 vaccines. You indicated earlier that 361,603 have been administered. That leaves about 600,000 either on the shelf somewhere or what's going on. And clearly there's a disconnect. Providers in Greater Cincinnati, Governor, have said, we are ready. We just need supplies. What's happening?
Yeah, here's the deal. We had a slow uptake at the beginning. Quite candidly, some of our hospitals weren't moving as fast as I wanted them to move. We love them. They're great, but they weren't moving. They were over Christmas. They were over New Year's. That has been rectified. We're rolling along. We've told the hospitals that they need to switch, and they need to switch over Sunday night from doing their own personnel. They need to go ahead and start doing people 80 and above. So we think that's going to work. Where it gets complicated, and I don't have the exact numbers, but roughly 350,000 doses had to be set aside. Federal government required this. So they said, you got to bank these right off the bat. And so these are the ones that go for first shots in all congregate care, not just the nursing homes, but other congregate care. So right off the top, we had to assign back to the federal government 300 and some of these. And that's okay, that's the way they do it, but it skews the numbers. We don't have them in Ohio. And so we are now drawing these down. The pharmacy companies that are doing the nursing homes are drawing them down, but they got a ways to go because they'll go from the nursing homes to assisted living, and then there's other congregate care settings they're going to. So that totally skews the numbers. So what we have done, so that I can keep some track of what's going on, our team has been only looking at what is in Ohio. So when it comes in, when the nursing home draws it down out of that bank, not the nursing home, but the pharmacy company that's doing the nursing home, they draw it out of that bank, we count it. We count as coming into Ohio, and we count as a shot being given at the same time. So these numbers will rectify over a while. What I wanted to know is, of the shots coming into, of what we have been given physically in Ohio, what percentage are we getting in? As of last Sunday, and Sunday's a good day to look at it because this stuff comes in on Monday, Tuesday, Wednesday. And so then you're trying to get them out. So by Sunday, most of them, you know, a good number of them should be out. Most of them should be out. As of last Sunday, we were at 72%. That's not high enough. We, in my opinion, should be about 85%. And that's my goal, is to get us up to 85%. But, so that's it. Sorry for the long answer, but it's frustrating and it's complicated. But the real issue is for us to judge how well we're doing is, of those that have come into Ohio that we control, what percentage are we getting out? And so what will happen is on Monday, Tuesday, let's say when you get to Wednesday, that percentage will be lower that you're doing because you just got them. But by Sunday or Monday, you should have that percentage up to something decent. And so, as I said, it was roughly around 72% last Sunday, not where I want it to be. I want it to be about 85%. John?
Yeah, let me just add, Todd, it's not like those are sitting in a freezer somewhere in Ohio. They've been allocated to Ohio, but they don't physically exist anywhere in Ohio, except for that group that the governor talked about. Allocated, but they're not in a freezer in Ohio. They're not in our possession.
Thanks for the question.
Next question is from Tom Jackson at the Sandusky Register.
Hey, Tom.
Hi, Governor. Thank you for taking my question. Governor, I've been tracking vaccinations at the Bloomberg and New York Times news sites, and they say that Ohio is behind all the surrounding states in the rate of giving shots. We're way behind West Virginia, but we're also behind Michigan, Pennsylvania, Kentucky, and all the other states. Have you looked at why we're running behind the states that surround us, and does your team have a plan for getting us caught up?
Yeah, well, I don't think we are. I don't think that's what it shows. My understanding is, if you look at nationwide where we are, and I'll bring a chart in next time, and you can look where we are on percentage and all kinds of different things. We look at that all the time. My understanding is, you know, we're 7th in the nation in population, and we are 7th in the nation in getting vaccines in. So we're basically where we would be expected to be. Is that good enough? No, it's never good enough. But Tom, I'll bring in the data. We look at the different data, and you know, we are, as I said, 7th in the nation, 7th in population. We like to be better than average, but we are where we are at this point. I will again say that some states, you know, West Virginia, for example, has done a very, very good job. They are not in the national pharmacy program. They had, you know, a fraction of the pharmacy, excuse me, they're not in the national pharmacy program to do nursing homes. They have a lot fewer nursing homes than we did. They didn't go into the program. Program is what requires you to bank all these. They had their National Guard do it. We had too many nursing homes to have our National Guard do it. But West Virginia's done a very, very good job. But if you look at, you know, the number, we put a real premium on our nursing homes. And we're proud of where we are with our nursing homes. We kind of went frankly, where the people are that we needed to protect, where we had the most deaths. But we'll come in on Tuesday with the different data points, and you can see where we are. And in fact, I'll have my team reach out to you and give you that after this press conference.
Next question is from Laura Hancock at cleveland.com.
Hi, sorry about that, Governor. I just have a question about not the people with the early onset that you're gonna, you know, those conditions that you're gonna announce next week, but separately, we're hearing from folks who have pre-existing conditions like cancer, heart problems, lung issues, type 2 diabetes, that might be eligible for COVID vaccines. Some other states have included these in 1B. When do you when do you plan to include them? You know, where
Yeah.
are they going to be in the?
Yeah, let me start the answer, and I'll refer to Bruce for a moment. Very compelling, very compelling. In fact, Bruce and I were talking about this a few days ago. Someone who's a cancer patient, someone who is on chemo. These are just horribly difficult, and you try to figure out in a way that's manageable so that you can get the vaccine out quickly, but also that is respectful of, frankly, who's the most vulnerable people we have out there. And so the definition that we are using is a definition, I believe, Bruce, that came from the CDC, but I'll let you answer the rest of the question.
Sorry, Governor, I'm having a little bit of trouble getting off mute. Yes, I would agree with your answer. First of all, when we look at the challenge that we have, which is the challenge of having this wonderful tool, vaccination, but simply not having supply to be able to offer it to everyone, we are, of course, compelled to look at the very difficult question of, well, how do we most effectively share this resource? And as the governor said, when we look at the data tells us very clearly that the number one risk for mortality from COVID-19 is related to age. When you keep everything else equal, age is the thing that points most clearly to the risk of mortality. And so by setting the 65-year-old limit, you've heard the statistics. We're able to cover about 87% of that risk. If we were to drop that down to 50, we would cover between 98 and 99% of that risk. So that gives you an idea of how age is closely tied. So we have not yet reached the point of having made decisions or definitions for the phases after 1B. But we are very carefully considering what do the numbers tell us and how can we do the most good for the most people.
And I would just say, to add to that, to give everyone a good perspective of that, our 1B group is about 2.2 million people, if I recall correctly. The vast majority of those in 1B, of course, are people over the age of 65. If you go to 1A, as I recall, it was somewhere between 800,000 and 1 million. Now, that doesn't mean they're all taking it. So these numbers, you can take these numbers down some, but that would be the total group if it was vaccinated. So as Bruce said, if you go down to 50, you're taking care of virtually everyone, not everyone, but, and so we're trying to continue to look at this. I know there's a little frustration. People have said, well, where do I come in the queue? You've only announced 1A and 1B. But again, those two combined are over 3 million people. So we've unfortunately got a ways to go. I wish that next decision was upon us and that we had already had 2 or 3 million vaccinated. But we got a long way to go. And so we're trying to look at that and come up with something that is equitable and fair and protects people the most.
Next question is from Dan DeRose at WOIO in Cleveland.
Hello again, Governor.
Hey, Dan.
I keep referring to this as a logistical ballet, and I don't envy what you and your staff are trying to accomplish here. One of the issues that I see coming up as far as registering, so we know in Northeast Ohio, it's going to be Giant Eagles, Mark's, Drug Mart, Acme that are going to be holding their own registration process. So if I want to get my 81-year-old father-in-law a shot, I am going to register at every single one of those places. Are you worried about sort of the overlap that if I register my father-in-law at several different places, that he gets accepted at Giant Eagle, then at Mark's, then at Drug Mart, and they're holding a vaccine for him, although already he's already gotten it?
Yeah, Dan, I think that's certainly possible. I mean, we leave this up to as we do in most things in life, leave it up to the local pharmacy to do the scheduling. I would think that, and we're going to see how this works the first week. We're going to see what problems we have. But I would think that if you got an appointment for your dad and got it confirmed, you have no real incentive at that point to try to game the system or to go into many different ones. Just seems to me that if people do get the appointment, once they get that appointment, they move on. Will there be some problems? Yeah, there's bound to be some problems. But what I'm hoping is that the firmness of that appointment, which is my understanding what most places are going to do, you show up at 2 o'clock at, such and such a day, that once I've got that appointment in my hand, in my head, I'm probably okay and feel okay about my dad. But we'll see. We're going to watch it. And as I said, we're going to adjust it as we go.
Next question is from Justin Dennis at MahoningMatters.com.
Good afternoon, Governor. Thanks as always for briefing us. Ohio's vaccinations appear to drop off on weekends. Other states have been getting that work done on the weekends. Are there any plans to maybe expand clinical scheduling? And also, do you expect any more clarity in vaccine distribution scheduling with the incoming presidential administration? Have you heard of any incoming changes or plans?
Yeah, Justin, I'm frustrated by the weekend as well. In a crisis we're in, we just have to work through the weekend, and sometimes that has not taken place. I think that as we move out to more retail, I think you're going to see more of that on the weekend. But we're going to watch that, frankly, and we're going to push people to get that out. I mean, when we set a goal and ask them bare minimum, got to do it in 7 days. That we hope is pushing them. But you're right. It's a challenge. I don't like to see it. We're looking at it, trying to figure it out, frankly. As far as the Biden administration, they reached out to me again yesterday, I guess, and we had a very, very good conversation in regard to kind of how this thing is going to play out. I told them about, what we were seeing, what was working in Ohio, frankly, what was not working as well, and just kind of where we were, that we'd really front loaded this with nursing homes but it's an exchange of information at this point, and it's a good exchange of information. They're listening. We talked about, for example, their idea of having big sites to go along with the small ones. So you have both. And frankly, that mirrors where we are headed. We look at having some big sites, Schottenstein Center maybe at Ohio State, one in Cincinnati, maybe two in some of our cities. But we also want to keep the small as well, because it's an access issue. But that was something that we talked with the Biden administration about. They have talked about giving us direct help in setting up big ones. And we welcome, as we did with the Trump administration, we welcome any help that we can get as we go through this. So I think it's going to be a good work. It's going to be a working relationship. Frankly, we had a very good working relationship with the Trump administration, led by the vice president. So I look forward to the continuing good relationship with the new administration.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Andy.
Hi, Governor. Given the possible protests and the potential violence that could come from that, do you believe that the Ohio State House is safe and secure? And do you believe it'd be safe to even be on State House grounds this weekend?
The last part was what, Andy? Do I believe in that what?
Do you believe it would be safe for somebody to even be at the State House this weekend?
Well, you talk about the State House, you're talking about outside, I assume. Look, I can't tell any Ohioan not to exercise their First Amendment rights. People have a right to go and exercise their First Amendment rights. I would just say, though, that at a time when we have already seen violent people. You want to call them anarchists, whether you want to call them domestic terrorists, who infiltrated the crowd and in Washington, and who are out there, and we know they're out there. I think I might find a different time to protest. That would just be a recommendation. I mean, going down to Columbus and standing in front of the State House, our National Guard, our Highway Patrol is focused, as you heard this morning, on protecting the demonstrators and protecting everyone else and protecting the property. But if I was a citizen, it seems to me that would not be a place that I would want to go. But I cannot tell people not to do that. They're welcome to do that. We will protect them the best that we can. But we saw what happened in Washington, and we saw that there are people of violence, and we saw there are people who have no concept or any feeling for protecting human life. And the more video you see, the worse it looks. So there's some bad people there. And so if you're a protester that wants to protest whatever you want to protest, and you go down there to the State House, I would be concerned that you would be in there with other people who are different than you. They're violent. They're not after exercising their First Amendment rights. They're there to commit violence. I would worry about that. And so I would think about a different place to protest and maybe a different time.
Next question is from Kevin Landers at WBNS in Columbus.
Hi, Governor. Hi. There are no waste lists being created to prevent the expiration of unused vaccines. Health departments are signing people with no vetting process. Are you concerned about this? Will the state be providing guidance to health departments to make sure these no waste lists operate the same way with full transparency so the public can be aware and know when to sign up?
Well, I think we've gone over when to sign up and how to sign up. As far as waste, Kevin, I think about this and talk about this all the time. And our team does. And we've made it very clear to the 750 providers out there who will be getting this vaccine starting Monday, Tuesday, and Wednesday, pharmacies and others. We've made it very clear. Here's the priority. Here's what you have to do. If you get to the point where you're going to waste it, you cannot waste it. You have to put it in someone's arms. Here's the priority list. It's 1A, it's 1B. Here's who's 1A. Here's who's in 1B. And in fact, we are going back again to these providers again in the next several days and to tell them that again. This is gold. This is valuable. This is human lives at stake, and we cannot waste any. So, you know, I can't control 750 places, but they have every incentive, economic and moral, to get those in people's arms, and I have confidence that they will do that. John?
Yeah, Governor, I want to just add, look, with this next phase, we expect to have a supply and demand problem, but not too much supply, it's too much demand. We think that this process should have plenty of people who are ready to get that vaccine. But I want to reiterate something, Kevin. The Department of Health, and I have this, I've had it on my desk for several weeks now, has clearly made it clear to everybody who's receiving vaccines, whether that's health departments, hospitals, or these providers, exactly what they're supposed to do, that they're supposed to have a contingency plan. It says right at the top, ensuring COVID vaccine is not wasted, talking about how to distribute it to 1A, 1B. They have a number to call if for any reason there's more than 20 doses that they believe might be in excess, so that they can find alternative ways to distribute these. So there should not be a single provider in this state that is not abundantly clear to them exactly how they're supposed to distribute this, because they have been on notice for weeks now about how to do that. So I want to reiterate that. I said that during our last news conference, and I wanted to share that again.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hey, Ben.
Hi, Governor. I have a question here for Dr. Vanderhoff. Doctor, with the news out of the Department of Health and Human Services that they will no longer hold back doses of the COVID-19 vaccine, I'm wondering, let's say someone gets the first dose and then 3 weeks later the second dose isn't available for some reason. If this person then needs to wait a little bit longer for their second dose, will there be any issues? Would they still get the true 95% effectiveness even if the shots weren't taken perfectly on time?
Thank you. It's a very, very good question. It's actually a question that many people in the medical and scientific community have taken back to HHS and to both the outgoing and incoming administrations, because the medical community feels very strongly that providing the second dose of the vaccine in an appropriate time window, and as you know, it is a window, it does not have to fall exactly at the 3 or 4 week mark, depending on which vaccine you've received. But doing it within the expected and appropriate time window, we believe to be very important for assuring that we get the robust immunity that we know these vaccines are capable of producing. And we've been assured that what they are planning to do, in fact, will not compromise our ability to continue with our vaccination schedule that includes appropriate follow-up of doses. So we're looking forward to that. I will say that we do know from experience with other 2-dose vaccines that there does tend to be some forgiveness, some grace period that is available, but we don't have the kind of data right now that I think would lead us to feel good about making that as a policy decision.
And I'll just add one more thing, and that is that we don't know when those will be released. So that is something we do not know. We're talking, we're asking incoming Biden administration, when they think that will occur. We don't not know that. So as soon as we know that, we'll let everybody know. And again, that is going to give us a boost. But we also, as you point out, have to be very careful that we have that second shot there. Got to make sure we got that.
Governor, next question is the last question, and it belongs to Danny Eldridge of Hannah News Service.
Hello, Governor.
Hey, Danny.
So my question is about unemployment. So as far as I know, Ohio is still not sending out the extra $300 payments that the federal government approved in the Federal Appropriations Act. A number of other states have already started sending them out. Can you just talk about what's going on there? When can Ohioans start expecting that are unemployed start getting this money that they need?
Yeah, I don't have the director on here, so I'm not sure I can answer the exact date. Do you have anything to add in that, John? I don't know if you know either.
I don't know the exact answer to that question, but I believe the $300 payments are already going out to the people who are signed up. I do not believe that they're going out to people who have not been signed up for them, but let us confirm that. I'm just trying to recall from memory the latest information I saw, but Danny, we will have someone from the team get back with you on the exact numbers for that.
Well, I want to thank everybody. We look forward, unless there's some emergency, we look forward to seeing you all on Tuesday. Go Browns.